Hi everyone, this is Dr. Stefan. In this video I'd like to answer a really good question that I got, and it's about whether inhalers work in emphysema. This is a great question. So it's something that I wanted to address, I think, for a long time, and this comment prompted me to address this question because many patients have this situation where they are diagnosed with emphysema, maybe with other conditions. We'll discuss this in a second. They are started on inhalers, but they don't see a lot of benefit. And I think that's really important to understand and to explain a little bit why that happens. So first of all, just to clarify, emphysema is a condition in which the lungs thin out a little bit. There's destruction of the actual lung tissue, unfortunately. And there are areas where the lungs no longer work. There are non-functional areas of the lung, usually accumulations of air, bully or things like that. There are basically these cavities that contain air in the lung. When that happens, you can imagine that that area, which is just a cavity, doesn't have the surface area required to transfer oxygen and carbon dioxide across that membrane. It doesn't exist. So the lung has lost its capacity in that part. Now, what can happen is that air becomes trapped in these little air spaces. And when you're trying to breathe in and out, this cavity doesn't really vary. It doesn't stretch out and get smaller. The air can get trapped, and actually the rest of the lung can become compressed by these cavities, and you have an area that doesn't function in that cavity, but then because of the pressure from that cavity filled with air, some of the other bits of the lungs around it don't work as well either because the air doesn't really get in. So in that situation, in severe emphysema specifically, going on inhalers doesn't really help that much. It can help somehow because emphysema usually is part of a larger condition called COPD, chronic obstructive pulmonary disease. Now, COPD is usually a mixture of emphysema and chronic bronchitis. Now, chronic bronchitis is an airways disease. So you can imagine the lungs are these big spongy tissue blocks, and they have little airways, little tubes that go into all the bits. The airways themselves can be affected in the same way by smoking, by exposures to noxious chemicals, inhaling dust for long periods of time, etc., etc., etc. And those airways can actually become a little bit narrowed, filled with mucus. That's a staple of chronic bronchitis. Inhalers treat the airways, the little tubes that go into the lungs. They don't treat the lungs themselves. They treat the little airways that go into the lungs. So if you're on inhalers, you're basically treating that component of COPD. Getting rid of some of that mucus, you're trying to open up the airways with medications, and that is really where the inhaler works. It helps move air in and out of the lungs a little bit better. Of course, if there's severe emphysema and the air gets in, but it gets to that bulla, to that sort of air cavity that cannot expand any further, you can imagine that the air doesn't really go in there, despite being on great inhalers. So this is one of the reasons why in severe emphysema, you may only get a partial benefit from the inhalers. You're treating one of the components of COPD, but you're not treating the emphysema. And in situations where the emphysema is severe, inhalers don't work as well, unfortunately. But that doesn't mean that you shouldn't try them. So if your doctor prescribes inhalers for emphysema or for situations where the damage is a little bit irreversible, I think personally you should still use them, especially if they've been prescribed to you, because you might still get some benefit. Maybe you get 10% improvement, 20% improvement in your ability to exercise, to do your work, to do your daily activities, and this is still a gain. But what else can be done, especially if you're suffering with emphysema that's a little bit irreversible? It's important to discuss this with your doctor. The first thing I would say, regardless of the condition that you're having with your lungs, probably pulmonary rehabilitation or exercises for your lungs, this is the main thing you should be focusing on. You should not be inactive. If you're suffering with lung disease, you need to keep your respiratory muscles active, moving, working, firing, because that will help you cope better with the damage to the lungs. It will help you cope better when you're, for example, getting a chest infection or some other flare-up, some other health problem that makes you require more air, and you're struggling at those points in time when you're having something on top of your chronic respiratory disease. So being able to cope by being strong enough to deal with it is really important. So that's the main thing. The other thing, for emphysema that's really severe, sometimes there can be procedures that can be done either via a camera, where some valves can be inserted to sort of reduce the volume of those cavities to let the rest of the lung expand, That's something you can discuss with your doctor to see whether you'd be a candidate for that. Sometimes there can be surgeries that can be done. So there are a lot of things that you may have to consider that can seem very, very invasive, and I understand that, but it's important to have the conversation to see whether you'd be eligible for further treatments. Now, most people, though, do not have emphysema that's that severe. So in most cases, inhalers will still work. So this is what I want to end with, just to say that you should be reassured in some extent that if you are on the right treatment for your lungs, if you're stopping smoking, if you're exercising, if you're taking your inhalers correctly, you should get some benefit, regardless of the severity of your disease. Now, if the emphysema is really, really severe, consider other options as well. Discuss with your doctors to see what other treatments you'd be eligible for, such as these procedures that I mentioned. Hopefully this was helpful, and I'll see you in future videos. All the best and good health.